Welcome to veterinary medicine in the state of Massachusetts. On behalf of the Massachusetts Veterinary Medical Association, we invite you into our world.
When an animal is not feeling well, the owners usually bring them in for the vets to look at it, and that's where we become sort of the pet detectives. We have to listen to their heart, take their temperature, ask a whole bunch of questions about whether or not they have vomiting, diarrhea, itchy skin, whether they seem painful in any way. We perform various tests, blood tests, x-rays, and all kinds of diagnostics to try to figure out what's wrong with them since they can't talk to us and tell us.
When I'm on the farms, it's everything from wellness to emergency work. A typical day could include a horse farm where I'll do vaccinations, take a look at sick horses. An animal that on that particular farm may have had a case of laminitis or uveitis in the past, and they'll want me to recheck that animal to see how well it's doing. At the same time that we're taking a look at the other animals and making sure that they are healthy and vaccinating them. Occasionally taking blood samples to test for various diseases.
Today we're doing a surgery that's very common for orthopedic surgeons in veterinary medicine, and that's repairing a dog's knee that has a torn ligament. Madison is our patient today, and she tore her anterior cruciate ligament.
Being a neurologist, my favorite tool that's available to us at MassVet is the MRI. We've got a new 1.5 Tesla MR scanner that I think is pretty neat. The other diagnostic things that we have here are CT scan, ultrasound, video endoscopy, video otoscopy. The underwater treadmill, the physical therapy is a newer addition to veterinary medicine in the past 5 years and has been the icing on the cake for helping animals with post-operative rehabilitation.
We have radiation therapy, we have chemotherapy, and we have surgeons as well. There are several types of cancers that are very responsive to chemotherapy. Lymphoma tends to be one of the more common cancers we see, and that many of our patients will respond well and have a good quality of life.
The dogs and cats seem to tolerate chemotherapy much better than we do. A lot of that may be related to the different dosing schemes that we use and our goals of our treatment.
I chose to become a veterinary pathologist because when I went to vet school, I thought what was really most fascinating was understanding how the diseases worked and processed in each animal. And really the best way to understand that is to understand the pathology that underlies each disease.
A lot of people, always say, why do you have veterinarians in the Army? We do take care of military and working animals. I get involved in that quite a bit in Afghanistan, taking care of working dogs. We take care of pets, mostly in terms of providing, health and welfare for the soldier, but also to prevent zoonotic disease transmission and whatnot.
An average day for me will be to come in, walk through the facility, make sure there aren't any issues that happened overnight, because the animal control officers, they are on 24-hour call, so they may bring animals overnight. So I walk through the facility, make sure that all the animals are okay. And after I do that, we vaccinate the animals that are new admissions. Sometimes animals may need to be treated. Those are dealt with. Sometimes animal control officers come in with an emergency, and I deal with those as I see fit.
We get a very talented group of applicants to the veterinary program. They come not only from Massachusetts, half of our class comes from Massachusetts and the other half from across the country, but they're very well qualified, very motivated, bring lots of interesting background experiences. So we get people not only that are pre-veterinary, but also folks who come from second careers, who've come back that were engineers, that were musicians. So we have a diverse pool.
Today started at 8 o'clock with Dr. Matsis teaching us to do a mare palpation lab. We did rectal and vaginal palpation of a mare and took cytology and culture samples. Looked at those under the microscope, and we just finished that. And then we have zoological medicine from 1 to 3, and then theriogenology from 3 to 5. And that's a typical third-year day. You pretty much go to class from 8 in the morning till 5 at night.
Loving animals is the #1 first minimal requirement for going into this profession. But there's an awful lot more that goes into it besides just loving animals. There's incredibly detailed science, hard work, long hours, dedication to a career that is quite consuming of your lifestyle. So get to know what the profession's really all about beyond just the fact that we love animals and get to spend time with animals.
And I love not knowing what I'm going to do each day. I wake up in the morning and I know that I'm going to be with animals and with the people that love them, but beyond that, I have not a clue, and that's very exciting.